But I got a question. I'm all the way from Australia earlier today, and so I'm hoping that she might see this video. And the question is, what's the difference between all-on-4 and a bar overdenture? Because her dentist is recommending that she get a bar overdenture, and so what are the indications or what are the reasons why you'd want to choose something like a bar overdenture versus a all-on-4 bridge? So I do need to introduce this good-looking guy over here. That's my little boy. What's your name?
Hi, my name's Lincoln.
Lincoln. What did you do to start today?
I just made my own YouTube channel
Heck,
with my dad's help.
that's right. It's awesome. So I had to like put a little plug in there for him. So Bros X, right?
Yeah.
He's gonna start doing some cool videos. He's gonna do some inspirational videos. But let's get focused back here again. So let's just really quickly define what a snap indenture. I just typed in on the top here, um, bar overdenture, and this is what kind of comes up. So the big difference between a bar overdenture and a regular overdenture is that there's a bar that supports it. So when you have your teeth taken out, there's really two different types of treatments, and one is where we call it fixed device, something that's fixated in place and it's not taken out. The other type of device is what we call is removable. Removable meaning that a patient can remove it. Okay, it's not to say that a fixed device you can't remove. You can. It's just that it's not made for a patient to remove. A doctor can remove it. So really what we're talking about is fixed versus removable. And when we talk about removable, you can branch into a regular denture, a snap-in overdenture with 2 or 4 implants, or it could be a bar overdenture, which is what you see here. You can kind of see how there's an implant, they have implants, and you see a bar, and then what you have is you have these attachments like this here that hold the denture in place, and so it's these attachments that typically are going to be made of some type of nylon or some type of plastic material that has the ability to kind of flex and it's what retains the denture, right? So so again, snap-in denture, you have at least 2, most of the time 4 implants, and there's no bar in between them, meaning that those implants are acting independent of each other. Okay, meaning that there's no like cross arch stability, meaning if you bite on this right side all the time, that implant which is being connected to it would feel more load than an implant on the left. Okay, so when we talk about when we talk about a snap in overdenture that has a bar, then now you're basically going to connect everything together with all those how can I say it? So as you can see here, when a patient bites here, now that implant's being supported. We call it cross arch stability. Okay, and so what are reasons why doctors like this treatment? It's not super common. Maybe 15 years ago it was a little bit more common before all-on-4 became more popular. But what's great about that treatment is that it does allow the patient to be able to control taking the device in and out of the mouth. Okay, so that's one positive. For some people, they may like to be able to take the device in and out. The biggest drawback that I've seen on these is that really comes down to these attachments. The same thing with a regular overdenture; they have to be replaced often in order for that that to work great. Meaning that every time you go in for cleaning, you may have to have those. Um, yeah, go on. You're watching it there.
Yeah.
Okay, so you may have to, and that just increases the cost. So if you're paying, a few $100s for cleaning, and now you have to add in a cost of attachments, a lot of patients get, they just get worn out. They get frustrated, and they feel like they're getting nickel and dimed. And so that's probably the biggest drawback but there are some indications for it, and you know they are significantly stronger than a regular overdenture, because it is being supported. So let's go back to, if I was to put in here, let's just take out the bar portion, right? Let's do this. Okay, so this is a regular denture, you know, and now you don't have any bar in between. Okay, so when we're talking about these, now what we have attaching them is this. So now you have an implant and you have a male female fitting. So this is in the mouth, and that blue portion, or could be lots of different colors, but that portion there is what is in the denture. So my where I'm going with this is that, uh, with a regular overdenture that you see, so here's a snap, here's the bar overdenture, and here's a regular overdenture here. When there's no bar, it requires that the device is really, really, what? I know, it's okay. But I'm trying to talk here, okay?
Hey, sorry.
It's okay. He's like, there's people watching, so it's all good, bud. But uh, when we talk about overdentures, it really does require that you have a really intimate fit with the gums. And what I mean by that is that, um, it can't be all supported on top of, uh, so like if we take this example here, and again, I'm not trying to hijack anybody's, you know videos here. You can see them. I guess technically I'm giving credit to whatever it is, but meaning that the denture is being supported by implants, um, and also the gums. So so that means that if the gums aren't connecting or touching the overdenture, then you're going to have issues. The inserts, or that connection to the actual locator, or this connection here, it's going to get worn out really quickly, and the denture's at risk of breaking, because it's like basically stilettos on glass, and so this is one of the things is that people don't like, is that they have to switch out those inserts often, and on top of it, if their bone starts to change, they have to have what we call relines, where we add material into, the device. And I did this just today with one of my patients, and you're looking at, from $500 to $1,000 just for a reline on, to add that space in. So it's one of those things where you, really have to do, you have to know what you're buying, because if you're not paying attention, and you're not doing a great job with your maintenance and coming in regularly, listening to your dentist, and uh, then what's going to happen is you're going to go to the doctor's office, and I'm backing up right now because my wife's over there saying, "Hey, get out of my way." But what happens is that it can be a really big surprise for that patient, and they get really frustrated. I relate it to like a printer. You can buy a really cheap printer, but then, oftentimes you get frustrated because the ink is what costs a lot of money, right? So I did overdentures for years, but no more than like 4 or 5 years. But after that, I just decided it wasn't worth it, because patients just would oftentimes get really frustrated. They wouldn't come in for the regular maintenance, which would make it more difficult uh, for these devices to last as long. Because it's really critical, if you're going to get a snap indenture, that the inserts are being switched out, regularly, that fit, the denture fit to the actual tissue is intimate. And if you're not doing that regularly, then you can have problems. So now let's move on to this bar overdenture here. Okay, now when we talk about the bar overdenture, now it's not important that denture is actually touching the tissue. It's 100% supported by the bar now, meaning that it's not like a 50-50 support where you're relying on that tissue. And that's good for patients that, don't like the, feel uh, of a denture, and they don't like the movement. So with an overdenture, a regular one, let's go back in, because it's slipping in and out of this, there is movement. One of the things I'd always hear from patients with overdentures is, "It's still moving, doc," and they grab it and they'd be like, "See, it's moving." And I would tell them, yes, it has to move. If it doesn't move, then that's the day that it's going to break, right? Because it relies on that movement as you push on the tissue, and as it moves inside that insert just slightly, that's what needs to happen. Otherwise, the forces are too strong. So, which brings up a whole another thing. So, if you look at like overall ability to chew and eat, let's baseline it like when you're 18 years old, just graduating from high school, and you have all of your teeth, and you bite down and you're chewing. Let's say that's 100% of your bite. Okay. Now, if you take out your teeth and you go into a denture, no implants, you are going to only have 30% of the forces you used to have. Okay. So then the next step up would be, okay, what if we add four implants and do a snap indenture? Now you're going to be somewhere between 60 and 70% of the force. Okay. That means you'll have a diet that's like 60 or 70% of what it used to be. Now, when you jump to a bar overdenture, now you aren't because there's no cushion as you bite down. Your patient's biting down, and because it's basically metal on metal, now you're going to have closer to like 90% of the bite, um, and that's because you're basically intimately metal on metal into bone. Okay, that bone transfer, that physics is just much more stronger. And then as you go to like an all on four or a fixed device, right, that never comes out of the mouth, now you're up toward 95 to 100% of the bite back. Okay, so I'm kind of jumping all over the place a little bit here, but the question that was asked from this gal from Australia, it was a nice, really well thought out question, and that is, what are your thoughts on it, and is it a good idea? Why would my doctor suggest this? And the main reason why a doctor might suggest a bar overdenture would be if they truly believe that you're not going to be able to take good job cleaning it. So if hygiene is a big problem, let's say you have really bad dexterity, um, and you can't use a water pick, or you can't brush your teeth very well, or you depend on someone to help you, and you don't have, like, say you're really elderly, um, that now the device coming out of the mouth and being put inside a cleaner, it might be easier for that person. Okay, that might be one reason. Another reason might be that as far as lip support, when we put devices in, if a patient is requiring more lip support, so if you look at all these are all dentures, right? Let's just change this up here, and if we type in, let's type in, let's see, okay. So let's just type in all on four, all on four dental implants, like that. Okay, so here's just some pictures that pop up. Okay, so you can see that this is much smaller than any of the other options, with whether it be denture, overdenture, or bar overdenture. Meaning there's no flange. You'll notice that there's no extension. There's no corners that go into the mouth. Okay, um, you can see that everything, it's like one big bridge. Okay, and versus, here's an example of a denture. Do you see how there's corners here and they overlap over the bone? Okay, so that compared to, this here, do you see the difference? Huge difference as far as material. Well, for some people that have lost so much bone, and you're trying to compensate for the fact that they've lost bone, and you actually want to push their face out, sometimes and this doesn't happen a lot, but it does happen, where they need extra support, meaning they need those corners to push their face out. Um, uh, that's why you would want to have a denture, meaning the design of a denture. And a bar over denture would be the highest up you could go with that, right? So you'd still be able to chew and eat with it. You'd have good chewing ability, not as good as the all on four, but close. Um, so now kind of getting into the nitty gritty. So what are the downsides? Let's say the two are the same price, and that's the actual truth. Is in my office, a bar overdenture is going to be the equivalent or even more expensive than an all-on-four zirconia bridge. Okay, and I think that's pretty standard in most offices, at least in the United States. But but the biggest drawback when you look at them, so let's say, so if you're chewing and eating and you have the same amount of force, then so let's take out forces in your ability to chew as far as how much pressure you can bite down on, because you have the bar, both have bars, both have really strong foundations. What's the biggest drawback to the bar overdenture? Well, again, going back here to this one picture here that shows an overdenture. Let's see, where was that? Where to go? Where to go? Oh man, it was here. So here, because there's so much more surface area, your ability to trap food in there is much higher. So that's probably the biggest thing. Is so when you're chewing and eating, you have a bigger chance of getting food caught in there, which drives you crazy, and then you have to go to the bathroom and rinse it out. So and that's probably the biggest complaint I would say. Secondly, it would have to have the inside of the mouth, so you'd have the top of your mouth would be lined a lot of times, not always, but but because it's bulkier, now you're going to deal with speech issues. And I'm not. It's not to say that you can't work them out, but I'm saying it's a little bit harder to get used to it. A really good prosthodontist or a good denturist or a good general dentist that does a lot of them, they plan for this and they can do a good job. But the average dentist that doesn't do a lot, oftentimes they create too much bulk, and that can create really big issues when it comes to speech and phonetics and talking and singing and cursing and swearing and no, just joking. But hopefully that kind of makes sense. If you go to materials, when you go to a bar overdenture such as this, most of the time you're going to have, uh, going back to, like, again, the bar overdenture. This is a regular overdenture, but I think there was it up here that had, um, this is just off the cuff, guys. I'm just kind of just talking real quick. But when we're talking about a bar overdenture, um, you are uh, materials wise, you are typically going to use, you're not going to use zirconia over the top of a bar. Zirconia is what's really, really strong. So you're going to be, so most of the time you're going to be using some sort of acrylic or PMA, polymethyl methacrylate, with ceramic teeth. What's the downside of that? Well, they just wear faster. So if you grind or clench your teeth are gonna wear down faster. Okay, meaning that they're just not as strong. Now, I have seen I have seen actually uh, just a couple times where they put zirconia over the top, but it's really, really tricky to do that over the top of a bar and make it removable, because of the attachments and everything, and it's really heavy. Zirconia is heavy, and so it requires a lot of retention if you're going to try to make it into a bar overdenture. So I think it's done, but it's a lot more difficult, um, and so. But the truth is that I'm not really passionate about bar overdentures, and so I don't know if I'm the best person to comment because I have 20 years of experience with them. But these are the things that I've heard from patients coming in. This is what I see, and to me, I like all on four because it solves the problem. It gets people back to a place where they can chew and eat everything that they love and they enjoy. The only, like I said, the only drawbacks when you compare the two, the only where I feel like it may have a little bit of an advantage, a bar overdenture would be if you really just either you need or you want to be able to take the device out of your mouth and clean it. If that's really, really important to you, then a bar overdenture would be great. And if you have severe, severe atrophy of your bone and you need extra lip support, for the patients that have come in and I was like, okay, let's talk about this, and I presented this as an option. What I did is I would make them, I would show them what I could build them in like a regular hybrid zirconia all on four, meaning that no snap in, and I'd show them, take pictures from the side, from the front, and then they could see what their profile looked like, and maybe it did change just a little bit. But I would say, is that enough that you want? Is it enough to warrant to go to a bar overdenture where you have something moving in and out, where the maintenance costs go up, where you have food getting caught underneath there? So it's like it's the yin and the yang. If you're going to go with that direction, then you just have to know that it's going to cost more. in maintenance. And relines, and your teeth are going to wear down more often. You're going to have food getting caught in there more often. And if all that is worth it, then and it makes sense. I found that I've been able to be able to create the profile with 99% of patients, and then when if they really are passionate and they want to go with a Bar Overdenture, I just tell them to go see one of our good friends down the street, a prosthodontist that can take care of them. And it's great because you got to stay within your wheelhouse. You don't have to do everything. And some dentists, they're really passionate about it, and that would be my biggest advice: is if you do want to have a Bar Overdenture made, then I would highly recommend that you go see someone that has a long history. And historically, that's going to be a dentist that's more like a baby boomer dentist, someone that's, and again, and I'm generalizing here, but someone that hasn't done a lot of all on four, that is really passionate about it, because the more experience you have with this stuff, and it really comes down to maintenance, and and it takes really good maintenance and really good communication to be able to make those devices work out. And because I don't have a large, actually I don't have any patients with a Bar Overdenture in my practice, because of that, I don't keep all that stuff stocked, and my staff doesn't know how to communicate as well as like all on four with zirconia, or with other options. And so again, you want to seek out doctors that have a ton of experience with it. Do a ton of research. Like I said, I kind of showed you how, just putting a couple words and going to images, what comes up, and I think it's really helpful. So I hope this is end up being a much longer video than I had expected. My little boy, there's my other son now. Here's Landon. My other son already gave up on me. He's inside, probably eating dinner. But hopefully that makes sense. If you have questions, or if you have any comments, please go ahead and put them in a chat, and I'll take a look and I'll try to answer them. But do your homework. I think that if you do your homework, there's so much information out there. You can make the right decision for yourself. Uh, I think that's all, and a lot more than I was planning on saying. So appreciate you guys watching my video. Subscribe if you want to. I need to recommit to make more of these videos. I'm such a perfectionist. Oftentimes I feel like I have to have everything just prepared. But these impromptu live videos oftentimes can be really effective. And I know my patients, when I've done them in the past, really do appreciate them. So subscribe so you can kind of see when I go live. And if you have questions, often I'll try to be I'll answer them. Maybe I'll use your question as the next live video. So appreciate you guys watching. Have a great day. We'll see you.